My neck was bothering me and down into it was actually through here. It was like in the upper part of the shoulder, which was a little different than normal. And so he was concerned about my neck because I was doing all kinds of, he's like, I don't like this. I'm like, I'm fine. But I think when I looked back, the big one for me was the middle of my shoulder blades. There was one night, probably 6 months prior, I hurt so bad, and I just thought that I had slept wrong, and I actually got up on the wall in the V and just massaged it out, and probably 20, 25, 30 minutes, it finally went away, but I came really close to calling my daughter saying, something isn't right here. But I ignored it, not thinking it was my heart. So Chuck and I have a long distance marriage. He's in California, Maryland, and so every morning before I go to work, we have daily devotional. Say good morning, spend about 30 minutes together before I hit the road. And I just didn't feel good. Because we live in a distance, there's a lot of traveling on the airplane, and that was the other thing. Well, airplanes make you, your shoulders hurt and your neck hurt. So I was just dismissing a lot of it as just regular life living stuff. So I go in, tell them what's going on. Of course, they immediately do an EKG.
So I met Miss Jacobs when she was in the emergency room at UF Health North. She came in for some chest pain and she was found to have like a mild heart attack. When I saw her, it was pretty obvious that she needed like a heart catheterization and possibly some invasive intervention.
And they did echocardiogram, did blood work, all of those things, and everything was fine until they did a second EKG.
I tried to talk to her, tried to explain what was going on, tried to sort of convince her that doing a heart catheterization was the best option for her. She had the procedure done by Dr. Sofer here at UF Health North, and she was found to have a pretty significant blockages in the main blood vessel that feeds the heart, which required a stent to be fixed. The procedure was very good, no complication, excellent results.
And what was really a little bit scary for me is I had started training for a marathon 3 weeks prior, and I was running at night by myself. So I felt very fortunate and very blessed that I didn't have an episode while I was running.
So yeah, after she was discharged from the hospital, since then she's been completely fine, no more chest pain. I've seen her in the office multiple times since then to adjust her medication, make sure her risk factors are under control, but she had no issue so far.
So she's in recovery and sitting with her daughter, Elizabeth, our daughter, and pretty much, after we kind of spoke about what was going on, what was transitioning, all that kind of stuff, and she got into her room, and I thought, I have not eaten pretty much since Tuesday morning. So it was already Wednesday night, and I thought, well, I'll go across the street, grab a salad, and get on back over here. And so around 10:30ish or so, I felt a little discomfort and felt something fluttering on this side of my chest. But, your mind kind of goes and you think, oh, okay, is that a bug or something? Because you don't think much about a heart attack, especially when it's over here, that's when you get concerned. So as it kind of slowly fluttered and made its way over here, I started to get a little more concerned. I knew something was wrong. I could just kind of feel it. And so once my body started to change a little bit, just about the time she woke up, and words out of her mouth were,
"You look like poo."
And after she woke up from her sedation, she realized that he wasn't all right. And he was also realizing that he wasn't all right. So they seek for help. He went to the emergency room at UF North, and he was found to have an acute heart attack, and was then transferred downtown to have an emergency heart catheterization done.
They go confirming patient's name, Charles Jacobs, et cetera, and I'm kind of watching them because, they got me on my side, and they kind of come back over. And all of a sudden I see her lift to the other one. She goes, Jacobs, that's weird. And I kind of chuckled a little bit because at that point I'm like, I think they already know that Lee was was a patient earlier. So so they just kind of, they were both looking at me. I started laughing. I'm like, was her name Lee? And they kind of caught themselves. Really? No way. And I'm like, yeah. I said, I'm not going to let her milk this stuff. I said, I'm a competitive man. I said, I'm going to see if I can outdo her.
And so I called the downtown, and the lady said, yes, ma'am, he's here. Let me transfer you to the operator. I said, okay. So the operator said, Charles Jacobs, yes, I have him. He's in room 518. And I said, no. That's my room.
Right.
And she said, no, ma'am. I said, no, I'm in the hospital too, but I'm in 518. Now, my room was actually 5118, but I don't know if the nurses at North dropped the one in front of it and just call it 518, but I heard 518. So I felt like that was kind of odd too. We're in the same room, different hospitals, more or less. It's funny because all of these little coincidences, a lot of people would call them. We're believers, so I just felt like God was showing up for me because I was nervous, but then with all this little stuff, I just felt like I was getting this. I got this. I got you. It's okay. We're gonna be all right. And I truly believe that all of it happened, my potassium tanked, all of it, just so I could get this guy down here. I was released. My daughter immediately took me downtown, and I'm sitting on his bed, but my back is to the door. And as I'm sitting there, this little sweet Italian lady with a heavy Italian accent comes in.
I went into the room and I said, Mr. Jacobs, me and you have something in common. Your wife is with my husband and I'm here with you. And at that point, he realized that he was feeling already a little bit comfortable because everybody knew that we were on the same family.
And I turned around and I said, no, his wife is here. And she goes, oh, that's so good, you got released. Thank you. And then she thanked me. She said, thank you for touching my husband's heart and telling him, thank you for saving your life. That meant so much to him. So we had husband and wife.
Doctors,
just crazy.
Mr. Jacobs at that point, he started to slowly recover from this big heart attack that he had. And we found also a clot, not only blockage in the vessel of the heart, but a clot inside of the heart. So we had to start to identify specific blood thinner medication that they could help him for the clot and for the blockage, balancing the bleeding risk, knowing that he's a very active man and for sure he wanted to go back to his active life.
So Chuck was very complex. He had a blood clot in his heart. 20% of his heart was dead, the lower left ventricle, and it causes the blood to swirl, which is what causes the blood clots. Mm-hmm. So they initially were talking about doing a bypass, and because of the blood clot and the dead heart, it would be a bypass to nowhere, or the highway, to nowhere. Mm-hmm. So they had to drop back, figure out, okay, how are we going to fix him? And so then they had to do a lot of stents. So you had stents, balloons, and they had to take him back into the cath lab to do this since they could not do the bypass.
But that whole process, even the day before, all staff just write into me, tell me what's going on, what's happening, all that kind of stuff, because you're very much aware of everything that's going on. You could see the monitor, the screen, see how they were going in and all that kind of stuff. And I'm a little nerdy that way, so I loved it. I mean, just the whole experience of them just doing what they do every day was incredible.
Just incredible staff and incredible people, made you feel great bedside manner, talk to you like normal layman's terms so that we could understand. So we have just had a fantastic experience with UF, and we love them, and we tell everybody about our experience.
So today they are really good. Lee recovered completely, 100%, no issues. She's taking her medication. She's finally getting her cholesterol under control, and she's thinking about going back running. Although she's a little bit scared. Rightfully, because of everything that she had, but I think she'll end up starting run again because she can do it and because she loves to do it. He's also really good. His heart condition is a little bit more serious, His heart is still weak. He's dealing with heart failure. So although he has no symptoms at this time, he still needs to take, medication, and he needs to be under a little bit, stricter control. But overall, they pretty much went back to their normal, busy life.
They were lucky, but I think that the fact that they are taking care of themselves and they are doing everything that needs to be done after this type of event is the most important part of this story. Because we know that there are patients that despite they have issues, they keep doing the wrong thing. But I'm very happy to say that Lee and Chuck, they are great and they are successful because they want to take care of themselves.
And they help each other, which is very important.
Yes.
I think it's probably the biggest advice I could give anyone that's going through any kind of symptoms. Listen, if you feel a little tingle, if you feel something in your arm, if you feel something in your shoulder, and it could be in your back also. There's just so many signs. And, don't brush it off, because most of us guys are like, we'll be fine. Yeah, I'll wait until tomorrow and see. Now, tomorrow might be too late. Trust yourself, trust your instincts. If you don't feel that well, if things are starting to tingle, things are starting to go on, go to urgent care, go to the hospital, do what it takes in order to make sure that you give yourself that extra time.